Let's get this in-service on the road so we can get done and get on to other things. Okay. Today we're going to be talking about HIV, AIDS, and sexual harassment. Okay, some of the objectives that we should be meeting with this one is to understand HIV and the nursing care needs, to understand prevention messages, to understand behavior goals and transmission situations, to increase awareness of HIV and aging, to review current statistics and prevalence, and to educate staff, patients, families with up-to-date information on preventative vaccines.
You're giving me an evil look. I'm listening. For once.
Okay, let's start with AIDS. It's an acquired implies that the disease has been obtained rather than one which a person is born with. Okay? And immune deficiency means that the person lacks the ability to fight infection because of damage to the helper cells by the AIDS virus. Syndrome reflects that the disease presents a set of symptoms that typically occur together. Okay. Although AIDS is caused by a virus, it is not contagious through casual contact. Okay. Evidence thus far shows that one cannot contract AIDS by talking to, sitting at the same table with, or living in the same environment with an infected person. Believe it or not, in this day and age, there are still people around who think that you have cooties and they can't touch you. Okay. Studies have shown that healthcare workers who have worked intensely and directly with AIDS victims for long periods of time do not have a higher rate of AIDS infections than the general population. Because we all know what standard precautions are, right? Okay. HIV is a virus. Viruses infect the cells that make up the human body and replicate, making new copies of themselves within those cells. A virus can damage human cells, which is one of the things that can make a person ill. HIV can be passed from one person to another. Someone can be infected with HIV through contact with bodily fluids of someone who already has HIV. Different viruses attack different parts of the body differently. Some may attack the skin, some the lungs, and so on. The common cold is caused by a virus. What makes HIV so dangerous is that it attacks the immune system itself. The very thing that would normally help you get rid of a virus, it particularly attacks a special type of immune system cell known as a CD4 lymphocyte. As time goes on, a person who's been infected with HIV is likely to become more ill and more often until usually several years after infection, they become ill with one of a number of particular severe illnesses. It is at this point in the stages of HIV infection that they are said to have AIDS. Okay? When they first become seriously ill, or when the number of the immune cells left in their body drops below a particular point, in different countries they have different ways of defining that. At what point they're considered to have AIDS instead of HIV. Okay. How long does it take for HIV to become AIDS? First of all, it's going to depend on the person. Okay. Without drug treatment, usually HIV progresses in an average of about 10 years to AIDS. Okay. This average, though, is based on a person having a reasonable diet. Someone who is malnourished may progress to AIDS and death more quickly. Antiretroviral medication can prolong the time between HIV infection and the onset of AIDS. Modern combination therapy is highly effective, and theoretically, someone with HIV can live a long time before it becomes AIDS. These medications, however, are not widely available in many poor countries around the world, and millions of people who cannot access the medication continue to die. So what are the symptoms of HIV/AIDS?
Fever,
Weight loss, and that's greater than 10% of their body weight. Anorexia, fatigue, recurrent diarrhea, greater than a month. Okay? Bloody stools, fevers, chills, night sweats. Kind of sounds like menopause. Muscle aches, white coating or spots on the tongue, enlarged lymph nodes, frequent or recurrent infections such as TB, candidiasis, pneumonia, or herpes, neurological signs, altered mental status, neuropathies, Kaposi's sarcoma or purple lesions or new growths on or beneath the skin, beneath the eyelids, or on the mucous membranes of the eyes, nose, and anus. So for diagnosis, the presence of symptoms and disease is often found to be secondary to AIDS, can cause a physician to be suspicious and screen for AIDS. The ELISA is an inexpensive test for the presence of AIDS infection. Okay? This test is highly accurate, though some false positives, meaning that the test shows the presence when the virus doesn't really exist, do occur. When the question arises as to the validity of a positive finding, the test can be repeated or confirmed with another test, such as a Western blot test. Other AIDS tests are still in development. Okay? A positive HIV test does not mean the person has AIDS. A diagnosis of AIDS is made by a physician according to the CDC AIDS case definition. So when we're caring for a patient with AIDS, it requires great skill and sensitivity of the nursing staff. In addition to the many physical needs that these individuals will have, considerable psychosocial needs will also be present as these patients continue the reactions of others to this diagnosis, the terminal nature of the disease, and other realities. If you didn't get a test, please let me know, because we may need to make some more copies. And to get credit for this course, you have to do the test. Infection control measures. Now this is one of those important things, so listen up. Wash hands before and after any contact with the patient. Of course, that goes to say for any patient in the building, right? Whether they have AIDS or not. Okay? Wear gloves whenever there is any contact with body secretions or blood, and when changing linens, performing oral hygiene, or cleansing after an incontinent episode. You need to wear a gown if there's any risk of soiling your clothing due to body fluids. Okay? Wear a mask or protective eyewear if there's a risk of splashing or spraying. Okay? Discard soiled linens, dressings, and respiratory equipment in heavy plastic bags. Okay, dispose of needles in the proper containers. Remember, we don't recap needles, and we don't bend them or break them. Okay? Do not share the patient's razor or other personal care items with other patients. And again, it has to be emphasized that the staff who cares for a patient with AIDS do not have a higher rate of HIV infection. So you're not going to get AIDS from the patient. Okay, HIV/AIDS patients have some nutritional needs. The infectious state of the patient raises the metabolic requirements and calorie needs. However, it also causes a poor appetite, sore in the mouth, fatigue, depression, and other symptoms that can interfere with the patient's ability to want to eat. Okay, then they have other problems like skin integrity issues. They can develop shingles, Kaposi sarcoma, and thrush are a lot of the problems that you'll see that can develop with AIDS, but not necessarily AIDS. Anybody who has an immunosuppressed state can have those issues. So don't just assume that because they have thrush, they have AIDS. You need to do daily skin checks. And patients who are not very mobile need to be turned every 2 hours. A lot of AIDS patients have diarrhea. And because AIDS gets into the gastrointestinal system, and that also makes us want to watch them very closely for dehydration. Okay? Drug therapies. At the present time, there's no cure for HIV infection. Most of the medications are aimed at managing symptoms, providing comfort, and slowing the progression of the disease. Safety. Residents with AIDS are at high risk for injury due to their weakened physical state and cognitive impairment. They need a lot of emotional support because they have a lot of anxiety, depression, denial, and grief. So you have to check their emotional status daily. A lot of emotional support is really needed. Education. Despite all the media attention, which has seemed to have died down over the last few years, it's still misunderstood by a lot of people. Okay, HIV-infected patients and their families, friends, and caregivers, and other patients need knowledge to calm the fears about the spread of any infection. And the patient really needs to know what his disease process is going to be. Okay, understanding preventative measures or messages. Condom use. The correct and consistent use of condoms can significantly reduce STD transmission. There also can reduce the risk of transmitting HIV, herpes, hepatitis B, chlamydia, gonorrhea, all of those fun, wonderful things. Okay, partner reduction. Instead of being out there swinging, they need to have fewer sex partners to reduce exposure. A lot of what you see is in with prostitutes and things like that. You'll see a lot of gonorrhea and those type things. So they need to reduce the amount of sexual partners that they have. Abstinence, we need to teach our kids that, but you know. HIV, I don't know, I lost my thought there. The only means to prevent sexual transmission of HIV is through abstinence. Okay? Okay. People who have been exposed to HIV need to know so they can get tested and into treatment if they've been infected. Knowledge of one's HIV status allows the individual to take part in prevention efforts that decrease the spread of HIV. STDs increase transmissibility of HIV. The presence of an STD increases a person's risk of acquiring HIV whether or not the STD causes open sores. Breaks or sores in the genital or rectal tissues make it easier for HIV to enter the body during sexual contact. STDs can stimulate immune response in the genital area that increase the HIV transmission risk. What is a behavioral goal? A specific action that an individual is willing to try to adopt that can prevent or greatly reduce STD and HIV transmission. Okay? Some sexual behaviors have a lower per pack risk for transmission than other. Oral sex lowers risk, vaginal sex
Moderate.
risk, receptive anal sex is the highest risk. Okay. Replacing a higher risk behavior with a lower risk behavior might reduce the likelihood of HIV transmission. Okay. HIV among persons aged 50 and older has been increasing in recent years. The increase is partly due to the highly active antiretroviral therapy, which has made it possible for many HIV-infected persons to live longer, and partly due to the newly diagnosed infections in persons over the age of 50. Why do you think that it's, another reason might be that it's increasing?
Because the people over 50 are becoming more sexually active.
Right. A lot of older adults think, well, I can't have babies anymore, so they're more sexually active.
Well, plus the Viagra too helps. Yeah, all
Yeah,
that.
all those nice drugs like Cialis and Viagra, and
Yeah.
all of those things. If you live in the villages, there's quite a few swingers clubs and
Oh
all
yeah.
those different things. And at one time, years ago, the villages did have the highest STD rate around.
No, that was false. That doctor isn't even around anymore.
It was
How
true.
about that?
Not false. No, it was false. No, it wasn't. No, it was false.
Okay, in 2005, a person aged 50 and older accounted for 15% of new HIV diagnoses, 24% of persons living with HIV/AIDS, which increased from 17% in 2001, 19% of all AIDS diagnoses, 29% of persons living with AIDS, and 35% of all deaths of persons with AIDS. In 2005, also the rates of HIV among persons 50 and older were 12 times higher among blacks and 5 times higher among Hispanics compared to whites. Many older persons are sexually active but may not be practicing safer sex.
Oh God.
Oh my. Okay. HIV transmission through injection drugs, injectable drug use accounts for more than 16% of AIDS cases in persons 50 years of age and older. Many persons compared to those who are younger may be less knowledgeable about HIV/AIDS and therefore less likely to protect themselves. Many don't perceive themselves at risk for HIV, don't use condoms, and don't get tested for AIDS or HIV. Older persons of minority races and ethnicities may face discrimination and stigma that can lead to later testing, diagnosis, and reluctance to seek services. Healthcare professionals may underestimate their older patients' risk for HIV and may miss opportunities to deliver preventative messages offering testing and early diagnosis that could really help their patients early on. Let's see. Many physicians can miss a diagnosis of AIDS because symptoms can mimic those of normal aging, such as fatigue, weight loss, and mental confusion. Early diagnosis, which leads to the prescription of HAART and other medical and social services, can improve a person's chances of living a longer, healthier life. The stigma of HIV may be more severe in older persons, leading them to hide the diagnosis from family and friends. Okay, so some barriers to preventative education and diagnosis. Many medical providers, number one, they don't review sexual histories with their older patients. They don't educate older patients about safer sex practices and are uncomfortable about discussing sex in general. For older adults, they believe that only the younger generation is affected by HIV/AIDS. They don't tell their healthcare providers that they are sexually active. Believe that condoms were used to prevent pregnancies and STDs. Okay, HIV/AIDS symptoms resemble those of other chronic illnesses. Weight loss, fatigue, night sweats, hot flashes, flu-like symptoms of diarrhea, respiratory problems, chronic pain or numbness, skin rashes, early signs of dementia. Older adults are told, you have lived a long life and may not be offered aggressive treatments. But, around here, they live into the hundreds, so, when they're 70 or 80 years old, that's not a valid statement. Okay? Older adults may not know that AIDS is considered a chronic illness for many. There's little research on combining AIDS drugs with medications required by other illnesses. Outside urban areas, healthcare providers may not know that older adults seem to do just as well on AIDS medications as younger adults. And many times the older adult has dual infections or disease processes to consider. In 2006, there were almost 3/4 of HIV diagnoses among adolescents and adults were males, 26% females, 73% males. The larger portion of HIV/AIDS was from men having sex with men, followed by persons infected through high-risk heterosexual contact. Although African Americans make up only 13% of the population in 33 states, they accounted for almost half of the estimated HIV/AIDS diagnoses made during 2006. And in 2006, persons aged 25 to 34 and 35 to 44 accounted for the largest portions of newly diagnosed HIV cases. HIV/AIDS and the aging may compound the economic losses of the aging. 68% of African Americans and 61% of European Americans reported marked decrease in income since diagnosis. They don't have enough money to live on. They have to give up work earlier due to the HIV. The older generation grew up and established their lives before HIV was known or talked about. Prevention education was largely unknown. Many have lost friends and family, so entire social networks are gone. Families may live out of state, and little opportunity to meet new people. Some have been activists, or on the other hand, have been very closeted in discussing HIV. Younger persons maturing into older age, living with HIV, there are many are long-term survivors. Isolation and loneliness are common. Support systems are gone. Lack of education and information. Ways to maintain positive experience and erase the stigma. Okay, what it means psychosocially to live 30 years with HIV. Prevention for positive issues. Feelings of long life with a complex infectious disease. Survival, fatigue, and depression. Continuous use of antiviral meds, and the normal aging process. Okay, therapeutic HIV vaccines. Designed to control HIV infections in people who already are HIV positive. Okay, preventative HIV vaccines are to protect HIV negative from becoming infected or getting sick. Researchers are developing the testing and potential HIV vaccines. Currently, there is no vaccine to prevent HIV. The goal is to develop a vaccine that can protect from HIV infections or at least lessen the chance of getting HIV if you're exposed. What are the CDC recommendations? Routine HIV screening for adolescents and adults, including pregnant women, in the healthcare setting in the United States. Okay. Recommendations specify routine testing for persons up to age 64, and people over age 64 should have counseling and receive testing if they're at risk. Making routine testing for older persons can help open a discussion about the risk between the physician and the older patient. There are different prevention strategies that should be developed for those who are potentially at risk. Things like knowledge, skills training, messages that are appropriate and culturally sensitive, things like that can help improve the communication. Successful media and social marketing campaigns can raise awareness of HIV in older people. Okay, now we're going to talk a little bit about preventing sexual harassment. Okay? According to Title VII of the Civil Rights Act, generally prohibits discrimination based on race, color, religion, sex, or national origin. Discrimination in employment generally means discrimination that negatively affects an individual's conditions or privileges of employment. And sexual harassment is a form of sex discrimination that is prevented by Title VII. Okay, types of harassment. There's what they call quid pro quo. You give me this for that, okay? Something else in return for something else, okay? Or a manager towards an employee. Conditions of employment, things like that. Types of harassment, there are different kinds besides just sexual. There's what they call a hostile work environment, which can be repeated unwelcome sexual conduct, interferes with your job performance, you feel intimidated, hostile, offensive to the work environment. That can include things like sexually explicit jokes, cartoons, comments. Some other examples of harassment would be name-calling, jokes, pictures, and/or objects that are offensive to one's gender, race, color, sexual orientation, national origin, religion, disability, or socioeconomic status. Other examples are unwanted touching, sexual advances, requests for sexual favors, or spreading sexual rumors. Inappropriate or unwanted or offensive remarks made in the classroom or the workplace. Impeding the progress of a student in class by questioning the student's ability to do work based on gender, race, color, sexual orientation, religion, national origin, disability, all of those things. Impeding the work of an employee by questioning the ability to do required work based on the same discriminatory factors. Okay, let's see. Examples: continues limiting access to tools, education, or work based on all of those same discriminatory factors. Even teasing about a student's choice or assignment can be considered harassment. Okay, several examples of sexual harassment: verbal, offensive name-calling, explicit sexual jokes and language, repeated requests for dates or sexual favors, comments about clothing, body parts, personal life, suggestive noises such as whistling. Nonverbal would be leering, ogling, circulating sexual materials or pictures, posters, computer screensavers, emails, calendars with a sexual theme, and lewd hand or body gestures. Physical would be unwanted touching, massaging, grabbing, hugging, or stroking, leaning over or standing too close, accidental bumping or brushing against, physical assault, and attempted rape. A victim of sexual harassment can be either male or female, or they can be same sex. They can affect anyone by any offensive behavior. The harasser may be the victim's supervisor, or a supervisor from another area, a coworker, a non-employee. Consequences of sexual harassment: loss of income, unfavorable work performances, disciplinary action, employee termination. False harassment claims, those can result in disciplinary action, employee termination, and personal lawsuits. What do you do if you think you've experienced harassment? Speak up. Advise the harasser to stop harassing you. Be clear and firm. Let them know that that behavior will not be tolerated. Notify management. Notify your immediate supervisor, your human resources officer, administrator, DON, director of your department. If we have a care line, you can notify them. Okay, come on, boys. Also, seek assistance promptly. Tell it to a trusted person. Then document. That's very, very important, is to document those things. Get your little calendar out, write it on there. Make clear to the harasser that the behavior will not be tolerated, and use the company process to report the behavior. Okay, you need to give detailed information, listing all of those things that are up there. Stick to the facts, don't add anything in there that doesn't really need to be in there. Okay, let's see. Okay, follow the facts. Familiarize yourself with the company policy. Address incidents of sexual harassment immediately. Cooperation between employer and employee. Thorough investigation of complaints and satisfactory results or resolution. Okay, number one, remember, sexual harassment is illegal, it's unwelcome, should be reported immediately, investigations will be completed and thorough, and there's no tolerance for harassment, okay? Now, everybody has a test? Okay.
Anybody need a test?
Do you have extra right there?
I have 2 extra.
2 extra? We need a couple more. Okay, we'll make sure you guys get them. And you'll get the answers. Okay, question number 1 says, if you experience sexual harassment, you should advise the harasser to stop harassing you and notify management. True. Okay. A supervisor who implies that he will give you a good evaluation if you have dinner with him is or is not an example. It is. Okay. All right. In 2005, persons aged 50 and older accounted for 29% of all persons living with AIDS. True. Number 4, condoms reduce the risk of transmitting HIV, herpes, Hep B, chlamydia. True. Okay. With drug treatment, HIV infection usually progresses to AIDS in an average of 10 years. False. It's false. Okay, now, while you're here, please If you did not sign the sign-in sheet, please make sure that you did. I'm not sure where it is at this point. Make sure I get your papers back up here, and then, wait a minute now, y'all are cordially invited to come to the bistro for cake to celebrate Joyce is getting her ARNP.